The impact of the COVID-19 pandemic has been devastating around the world for health systems and economies. But whilst the number of people dying from the virus has dropped markedly, the number of people dying because of its advent is apparently not. Medical Aid Discovery says it has seen a rise in heart disease and cancer claims. Specifically, they are seeing a spike in cardiometabolic disorders. This includes things like hypertension, elevated blood sugar, abdominal obesity, but they're also seeing a rise in the number of people dying from cancer. So, are these deaths caused by COVID-19 or the effect of the pandemic? I'm pleased to tell you we've got Guy Chennels, who's the head of product at Discovery Employee Benefits, speaking to us now. Thank you so much for your time and welcome to our show.
Thank you, Bongani. I've listened to you so many times. It's a real pleasure to be speaking to you.
Oh, fantastic stuff. I always love it when we speak to people who listen to the show regularly. Let's get straight into it now. You're seeing more people with illnesses that affect the heart and blood vessels as well as cancer?
Yes, let me make one correction firstly. This is not a study across the Discovery Health medical scheme. It's a study that we're able to do because we have a medical scheme. So what we have is a business that insures employees of employers.
Right.
So you call that group life cover. And we're able to match individuals to those who have Discovery Health and then determine the cause of death. No one else can do that in the country, unfortunately, because death certificates don't contain detailed cause of death information. So we matched those two data sets and we're able to pull out of that insights into what is driving deaths amongst, non-underwritten. So these are people who haven't been through underwriting to get their life insurance, employed individuals. So just kind of your general employed people in South Africa.
But obviously your unique insights probably give you a picture that we otherwise would not have. I mean, we know, for example, the pandemic affected key areas of health infrastructure around the world. Procedures were often postponed. Things like screenings perhaps delayed, even vaccinations for other diseases. Is that what is at play here? I mean, is it that we're not necessarily getting sicker, but that we're just not detecting these things as early as we used to?
Well, Bongani, I think it is a combination, and I have to say up front that we have to link the dots here. There isn't a straight line you can draw, and so linking the dots, what we do know. We do know from studies in Discovery Health that having contracted COVID, you then, following that, had an elevated risk of developing some kind of a heart condition. You also had an elevated risk of developing diabetes, by the way. And that risk was higher if you'd had a hospitalization because of COVID-19. So we know that that is a factor. But we also see really dramatic drops in screenings. And screenings, just so you can visualize it, at a regular health screening, you pick up your cholesterol level, your blood pressure, and some other basic markers that are the silent killers, if you will. You can't observe cholesterol and then suddenly one day you have a heart attack and you discover that your cholesterol was high. And so it's relatively easy to treat once you identify it. So it stands to reason. And in fact, 18 months ago, when we saw these wellness kind of levels dropping off a cliff, we predicted that we would see something like what we're seeing now come into play. That people having not picked up those conditions would then not be controlling them, and then it would lead to a greater incidence. The final one is just people's lifestyle behavior. We know that people became, on average, more sedentary during COVID, and that obviously leads to people putting on weight, eating less healthily, exercising less, and that, of course, increases your risk factors for cardiometabolic conditions.
So, I mean, all of that suggests then that natural deaths are still tracking higher than pre-pandemic levels.
That's what we've seen. Our study is up until June 2022, and certainly up to June 2022, it was still tracking above pre-pandemic levels. We repeat the exercise annually. It's quite a big job to do. And so we'll see, we might actually do a mid-year one because it's so relevant. But we'll see in time whether that continues to be the case, how long this effect continues for. Is it just a spike kind of following COVID and it all kind of comes out in the wash, or is this something that is baked in for a couple of years? We don't yet know.
What about the impact of long COVID?
Yes, so long COVID can mean, you've had COVID and you felt terrible during it, and you continue to feel terrible for some time afterwards. You have low energy, your taste remains gone. Perhaps you have funny sensory issues, and there are a number of other reported surprising conditions that people have maintained from having COVID and maintaining it for some time. Or it can mean, and this is what we meant in the article, as a broader blanket statement to cover, you've had COVID, it's led to other things. It's led to developing perhaps a blood clotting disorder that you were not aware of, and that has emerged later in a stroke or a heart attack, etc. Yes, Karen?
No, I was going to say there's so much we still don't know about what long COVID is, or all these other things, all these conditions that may have developed since people have had COVID. I mean, I'm hearing all sorts of things about COVID brain fog, for example, right? People now having impaired speech. Their memory isn't quite what it once was. Some poor, or at least an effect on cognitive function, all those sorts of things. And they're not all necessarily explained under a broad blanket of long COVID, are they?
Yes, those are so difficult because some proportion of people would have developed that some condition like that with or without COVID. And so it's very hard to determine, what is causally linked to COVID and what might be linked to other risk factors in a person or around a person through that experience, that period of time that they had COVID. But certainly I have the same impression that it does seem that these things are linked to COVID. We didn't hear of those things so much before. But as you say, it's something that we still don't know enough about. And there are plenty of people working hard to try and understand the dynamics at play here.
As an insurer, what does that mean for you?
As an insurer, it means we are nervous. We don't, unfortunately, have a crystal ball. We wish we did. But we continue to remain nervous because of I call it the sort of headwinds for the health of the population. The headwinds are these ongoing impacts of people still not screening at levels that they should be. People, still having carried over lifestyle behaviors from COVID that remain, people having been infected with COVID and have therefore increased risk markers. And then the big one that really is, I think, the next pandemic is the mental health impact of COVID. People losing loved ones, losing sources of income in the household, and people being under enormous stress at home without the sort of natural breaks of traveling to and from home, etc. And all of that accumulates and has an impact. And so we're nervous about those headwinds, and there may be some things that move in a positive direction and help to cancel it out, but we are nervous. Yeah.
Is it your sense that we've maybe taken our eye off the COVID ball? How should we be dealing with COVID-19 now?
It's a great point. The sort of headlines say COVID deaths down, and everyone says, "Phew, we can carry on." I think the headlines should have said COVID deaths are down, but this is what you can do to avoid replacing COVID with something else terrible. And the basic things people can do and need to do is to reverse the things I've described earlier, to go for screenings, to make sure that they're exercising and eating healthily and managing their mental health most critically. And so I really think there needs to be a stronger public health message around those dynamics. So another one is picking up HIV and diabetes, some of the big killers in South Africa, where screening rates were down dramatically during COVID as well. And of course, we know there are treatable conditions. So if people know about them, especially early, they're able to manage them.
A year ago, there was a discussion around, ongoing vaccinations against COVID-19. We understood this would be the norm after certain intervals, if you were. I'm not hearing much talk about that now.
That's very interesting, Bongani. I'm actually not close enough to the vaccine protocols. We follow what the government institutions who are responsible for this put out. So we'll follow what the kind of experts say. We do track as well within Discovery Health what our own data is saying, and so far that has really confirmed that vaccines are effective. But I suppose vaccines do come with risk. It is a health intervention. Every health intervention comes with risk. And so you only want to take that risk if it outweighs the concomitant risk on the other side. And I suppose where the world is at the moment is trying to work out whether the risks of new infection from COVID, given that, especially in South Africa, most people have already had it, or at least been multiple times vaccinated. We're not sure what the risk of a new variant of COVID emerging, people getting exposed to that, actually is.
All right.
And so I think those would be very difficult decisions to be making at the moment.
Appreciate your time. Guy Channels, the head of product at Discovery Employee Benefits.
Current events, developing stories,
tough questions.
Your voice making a difference.
This is Breakfast with Bongani Bingwa.